All right, we want to welcome you guys to this session, and I have Dr. Tim. Did people call you Dr. T ever?
No, usually Dr. Tim.
Okay, we'll call you Dr. Tim, but I like Dr. T. What does Dr. T say, right? You, of course, are my husband. And so, those of you that have not met Dr. Tim, he is, you know, number one of the best people like that you could ever meet. I'm not saying that to just be biased, but you guys know him, those of you that know him. And he is here to share with us he's obviously at his place of work there, their doctor's office. And just give us a little high level, Tim, about who you are and what your business does right now, kind of the facility and what you guys specialize in. And then we're going to get into some really quick tips on how we can help just be better knowledgeable and help ourselves be, and our families and our team be more, protected during this time. So give us a little bit of an intro.
Sure. Well, I've been a chiropractor since 1996 and in practice since then. And about 5 or 6 years ago, I integrated my practice. What does that mean? Well, it means that I brought in physical therapy and some injection therapy with a nurse practitioner and a medical doctor as my medical director. So now we're kind of more of a multidiscipline type of a clinic, and that's allowed us to expand our practice and do now we're into regenerative medicine. So we're doing the stem cell therapy. We're doing things like PRP, which is, a kind of a regenerative product that we use on people to help them with their osteoarthritis if they have knee and shoulder joint problems. Things that I could not do as just a chiropractor, I can now do, keeping the chiropractic philosophy that our bodies kind of heal from the inside out, very on the forefront of the practice. But
Yeah.
that's where we're at now. We're here in Carrollton, Texas, a suburb of Dallas, and that's us.
Yeah, and what I love about it is Tim is not the treating doctor. He actually has, phase 3'd his business where he has everyone that's treating, that's in production, and he's able to be there or not be there and have the team run the business, which is amazing, which was the reason you're able to talk to us today, even though you're so much in the know and you're bringing the best of the best to your team. So with that being said, we know that you work with some of the best doctors throughout the country. You mastermind with them. You guys just went through a training on specifically this virus. Tell us a little bit about how it's different than what we've seen in the past.
Okay. Well, as you know, a virus is a foreigner to our body, and it is something that cannot replicate on its own. So it has to have a host. So when it enters our body, it attaches itself to the very center of the cell, on the outside of the cell, and it penetrates by boring a hole, and then it puts its contents inside that cell. And again, keeping this high level, one important thing to know that a virus actually has the ability to take some of the envelope of that cell, a coating, and cover itself. So now our body's natural immune system does not recognize that virus as an intruder, but yet it recognizes it as self because it's camouflaged. And that's important to know because of what we're going to talk about a little bit later. But the cell in the center of it, it has this printing press, and it replicates its own self and makes more and more cells for your body naturally. But when a virus inputs its info inside it, now it starts to replicate that virus. So that's how the virus grows. And what makes COVID-19 as a virus more important or dangerous or harmful to us than, say, influenza type A or B, or the common cold for that matter, which are also viruses, is that those are called rhinoviruses. So they attach to the mucous membranes, and that's why you have nasal discharge and that sort of symptom. In this case, COVID-19, it attaches straight into your lungs. So as you inhale the particles, the virus contained in those particles, it attaches itself to your lungs, and very quickly it can decrease your body's ability to breathe because it contracts and causes so much inflammation in the smallest little tubes inside your lungs called bronchioles. So the bronchioles, instead of being dilated so you can get air through them, they contract. And now you have distressed breathing. And so the common cause of death, and the deaths, unfortunately, from coronavirus are actually pneumonia, because your body first gets the virus and then it builds up inflammation and then it doesn't function as well. And then we get fluid in the lungs and then we suffocate and die of pneumonia. So it's very important. The studies in China are saying that there's 4 types of cases, and I'll just briefly hit on this because it's important later. But the first one is just a mild case. That means that you just have symptoms of like cough or difficulty breathing. The second one is considered common, and that means that now it's starting to do damage on the lungs themselves, and you can see that damage on an X-ray. The third case is severe. That means you can see lots of damage on an X-ray. And then there's severe critical, the fourth case. And severe critical means that you're in complete distress. You're already on a respirator. And many of the deaths that have happened, both in our country and around the world, have been in that fourth phase on a ventilator, and they still died. So they're manufacturing their own, they can't manufacture their own breath, so they're getting the breathing machines working for them, and they still die. So it's very serious. We're taking it very serious. And that's how the virus works in a nutshell.
Yeah, and we're hearing, of course, what to do on quarantine, and we're just like other cities and counties and states, kind of shutting down and being careful. I mean, even Colton, not to take this lightly, he's making sure he's protected, just for you crazy people out there that like Colton. That we know we're not touching ourselves, our hands to mouth, and we don't like to say practicing social distancing. It's really physical distancing, because you still need to be social. You still need to create relationships, even if it's through technology. But we've got to be careful here and really think twice or 3 times about what we're doing. And so as easily as we can catch it, as easily as we can be a carrier and all of those things, we're hearing all about that. But tell us a little bit about how we can self-protect when it comes to our health, and the unfortunate predictions. We don't know if this is going to come true or not, because some of the cases we might never know that we even had it, for some of us that were very mild. But we could what are the things that we can do to protect ourselves if we feel like at some point there might be this mass contagion of having it, or it's rolled out in phases? What can we do at home today? You gave us a couple of tips in our first preview interview, but what are some things that you're hearing that we can do?
Okay, well, first off, you got to know that the CDC has guesstimated, their best estimate is that up to 60 to 70% of Americans will get this before it's all said and done. And so the social distancing that they call it, which is staying 6 feet away from someone, is simply designed just to avoid exposure. So that's the easiest thing we can do, is avoid exposure. If you're in high risk, if you are already immunocompromised some way, if you're an elderly person, then you probably need to just stay put. And that's the easiest way to eliminate the threat of it completely. If if you're getting your meals all delivered to you, then don't just take the boxes of food inside your house and think that you're safe, because whoever is touching that box could have put some virus on there that could live on that box for a while. If I'm using box like the way I'll eat pizza, but whatever you're ordering, the packaging, you need to wear rubber gloves and take it from the delivery driver, and then put it in your own containers and eat it and wash afterwards, and be careful about hands to mouth and hands to nose type of things. So that's number one, is just eliminate exposure. And we do that through being really clean, sanitizing our hands. Don't sanitize your hands more than 2 or 3 times without using soap and water for about 30 seconds. Get a good lather, get under the fingernails, do that sort of thing. That will minimize the exposure. As the weather gets warmer, then that social distancing is going to be slightly smaller, because the virus swells in heat and humidity. So when you sneeze, it won't project up to 6 feet. It'll only go maybe 2 feet. So that's just one thing that, as the standards kind of get released, they're going to change, is what I'm hearing, that those parameters are going to change. The second thing, after avoiding the exposure, is that you need to boost your immune system, right? We have one thing that can work for us. There's no cure. There's no vaccine. There's hardly any treatment. They're experimenting with treatments right now in malaria drugs and some antibiotics in combination. But right now, as of today, there is no treatment for this. And so the only thing we really can do is use our body's natural immune system that we've been using for 6,000+ years to fight off everything that we've had exposed to us. And that's what we need to do. We need to make sure that those little soldiers inside of us that are our immune system are ready and willing and able at their maximum ability to fight for us. And the way we can boost our immune system is to, watch what we eat. If you're eating a horrible diet, if you're on furlough for the next couple of weeks because your county's shut down, well, don't just sit around on the couch and eat pizza. Because now those soldiers that are designed to protect you from virus are having to actually fend off the junk food that you ate, processed food, fried fatty foods, pre-packaged foods, lots of carbohydrates and sugars. They cause inflammation in our bodies, and that inflammation then has to be met by our immune system. And all those soldiers are now called out to work on that when they need to be in defense of the virus. So the ways we can boost our immune system, some things that you can really do easily starting right now, besides eating better and eliminating sugar and that sort of thing, is to raise the pH of your tissue. pH is how your body is either acidic, below 7 on a scale, or alkaline, above 7 on that scale. And so if you're drinking soda and Diet Coke and Dr. Pepper all the time, then you're lowering your tissue pH. And in an acidic environment, things like virus and bacteria, they flourish. And so if we raise that pH above 7 by, taking an ounce of apple cider vinegar a day, within 3 to 4 days, we can actually raise the tissue pH in our body. It doesn't taste great, but you can do it for 2 to 3 days, 3 to 4 days. So that's one way. You can also drink alkaline water. You can buy special water that, not just the Ozarka bottled water, but the alkaline water that says specifically on the label that the pH is higher than 7. And they have them between 8 and 9, and that's a good way to alkalize your body. It just takes longer than the apple cider vinegar to do that, but it's always a good thing to alkalize with water. Another thing is there's a product called colloidal silver. And people don't understand what that is. It looks like a bottle of water, and if you taste it, it tastes like it's got a little metallic taste to it. Colloidal silver comes from an old saying that probably some of you have heard that says that person was born with a silver spoon in their mouth. Maybe the older people have heard that before, not so much the youngers, but that saying comes from when a rich family back hundreds of years ago had a child that was not feeling well. They gave them a spoon, and that spoon back then was made of silver, and they put it in their mouth, and what they were doing is their saliva was getting that silver into their body. And so now we don't have silver, we have stainless steel, so you can't put a spoon in your mouth and get the silver halide into your body that fights those things, virus and bacteria. So they make a colloidal silver. It's a little bottle that has silver particles in it, and that will kill infection. It'll kill virus. You can drink it. You can put it in your nose. All those things that work on the symptoms related to nasal and congestion, that sort of thing. And then the last thing is we can actually boost those activity of the lymphocytes in our white blood cells, which are the natural killer cells against virus. And so a couple of ways you can do that is you can bulk up on vitamin C. You can bulk up on something called glutathione. Now, before you go out to Costco and buy a big gallon jug of that, know that when you take too much vitamin C, there's a mechanism within your gut that shuts down your body's ability to absorb it. And then you start to actually pass it by going number 2. So you don't want to do that because you're not getting enough vitamin C in that pill form. So we have, people that do vitamin C drips, which are like an IV infused vitamin C. You can also get vitamin C delivered in a liposomal delivery system. And without getting into the science behind that, it's basically something you put in your mouth and you swash it around, and it absorbs through the lining of your mouth, and then it goes into your bloodstream. So you can get high doses into your body without ever having the diarrhea, right? You're actually getting many, many grams. And there's research coming out of China now, where in some of their hospitals over there, they're actually IV infusing up to 24 grams of vitamin C into a person through an IV a gram an hour. If you took a gram an hour orally, you'd have diarrhea in 2 hours. It's just too much for your body to handle. Yeah. So they actually can get it into your body without bypassing the gut and not having that system shut you down. That's another good one. There's also some more advanced type of nutraceutical products and supplements that, remember when I said that virus gets the envelope and that film around it, and now your body's immune system says, I don't want to kill that because I think it's part of me. Mm-hmm. Well, there's some film busting type of supplements that you can actually take. I don't know all the names because there's many of them. One of them is called Biocidin, and all of these products, by the way, can be gotten online. You can get them on my website. I pass them straight through from the manufacturer to the customer. I'm kind of the middleman, just in that you get on our website and order, and then the order gets placed through their website. But
what about like emergency? I mean, I know a lot of people can take the chewable, vitamin C. They can do the emergencies. Would you say that's something better than nothing?
Absolutely. Okay. So if you're getting any vitamin C, then you're doing better than by not getting any. Yeah. But just know that when you start bulk dosing, which is what protocols with virus like this COVID-19
you really need a lot to fight it.
You can't get enough orally, because that orally, even though you're chewing a pill or you're drinking a liquid, it's going into your stomach, passing into your gut, and that gut blocker comes in and says.
So when you're swishing it in your mouth, it actually can get through.
It gets into your bloodstream that way.
There you go. That's the difference. And then what
about the remainder? Go ahead.
I was going to say, what about like B12? I know we've talked about B12. I'm a big believer in, energy. So
sure. B12 is the same way. Getting it into your bloodstream is the best way. Okay. You can take B12 orally, but you won't get enough. Okay. And so what we've started doing in my clinic over the last couple of days, and going probably all the way through the month of April, is that we're giving everybody a weekly B12 shot. Well, I was about to say whether they want it or not. We're not giving it to those who don't want it, but we're not charging for it.
Yeah, so free B12 shots, and you may throughout the country, you may have a chiropractor or someone that might be doing some of the same things. I know that was recommended to you guys in that big seminar, and a lot of doctors are doing that. So you may ask around if you are getting out and seeing your healthcare provider during this time. And if you're local here in Dallas, that's something too, because you have to, this is a shot, right? It's not anything that we're putting in our mouth.
It's considered an intramuscular shot. So it goes into your muscle, maybe either in your deltoid or in your hip. And it's a tiny gauge needle. It doesn't hurt at all. Most people don't even feel it if they're kind of afraid of shots. But yeah, we deliver 1 to 2 milliliters one time a week.
Yeah, that's good.
You can do that for 4 to 6 weeks straight. You need that anytime. It'll boost your energy. The only way we get B12 into our through diet is by eating red meat. Okay. And so if you're a person who eats all chicken and fish and you never eat red meat, you're deficient in B12, and that could be a reason why you are tired or run down. We also have patients that are on specific weight loss programs, and a part of that program is a weekly B12 shot because it boosts your metabolism.
Yeah, that's good. And so, just knowing that, we as people that are trying to stay healthy, that there are other things that we're doing. What are we putting in our body that's going to keep us healthy, and what can we do as far as supplementing as well? So this is stuff we're not really hearing on the news, and so I'm so thankful that you're able to share this with us. And then I know that you also were reading on a study in China about stem cells. And so, there was a specific study taking 7 patients that were closer to, the end and having definitely difficulty, and just give us a little high level of that study.
You bet. So they took 7 people, and they were in those 4 categories. A couple of them were in the severe category on ventilators, and they injected them with an IV, through IV with mesenchymal stem cells. MSCs is what they call them, mesenchymal or mesenchymal stem cells. And those stem cells they get in your circulation and they stop first in the lungs. And so that's where the damage is done with this particular inflammation cascade, they call it. The cytokine cascade of the COVID virus means that it's just producing inflammation, which is producing inflammation. It's a catch-22. It's getting really, really bad in the lungs. So these stem cells put through an IV into your bloodstream, go to the lungs, and then stop. And up to 70% of them stay right there and work right there. And within 2 days' time, these 7 that got the MSCs were symptom-free in their lungs. And we're talking about people that were in the severe category with showing signs on their x-rays. And then when they got released from the hospital within 14 days, their x-rays were clear.
It's crazy. That's
so
crazy. So why are people not just like flocking to this? I mean, number one, I know it's cost, because this could be a good $1,500 or more y'all's cost. And so it's just not feasible. I mean, hopefully they can find a cure that's a little bit more easy. You know, we're not like having to do IV and those type things, but that's good news. I mean, that's great to be able to know there at least is option there.
You bet. Yeah. And they're working hard. The company that we actually get our stem cells from here in the office is the company who sent them to China and did the study. And the unfortunate news is to make it a study, you have to give a certain group of people a placebo, which means they think they're in the study and they're going to get better. And they actually just got a placebo injection with no stem cells in it, and they all did bad. They stayed in the hospital. They didn't have their symptoms reversed. I think one of them has died since. But the 7 that got the true mesenchymal stem cells, that comes from Wharton's jelly, which I don't want to go into the science of that. But if you get the true mesenchymal stem cells, that can decrease that inflammation so rapidly. Within minutes, your symptoms are changing.
Yeah, it's so good. And well, it's great. I mean, because we know that stem cells can, you know, when we're talking about, it doesn't come from our babies, but it comes from, you know, the surroundings of that. And so now we're able to use that for good, to literally regenerate. I know you guys are shooting people in the shoulders and in the knees and all of those things, and really just allowing, like, it's basically where we're able to I guess your body's able to really reproduce itself, those new cells, and because they're brand new, they haven't been used, you know. So it's such a good thing. Well, give us a little bit of a couple of, you know, last minute thoughts here. I mean, we have people that are hugely concerned, they're freaking out. Then we have people that are like, oh, this is no big deal, it's going to pass over time. But what would be some things that you are hearing from the medical field that you can just share with us that you haven't yet, that can kind of give people a nice reality dose, but not freak us out too?
Sure. I would say 2 things. One is that you can't operate from a place of fear or the unknown or opinion. And if you bombard yourself with the national news scene and the media all day long, and it's a constant rechecking the website to see if another one's died in my county, and that perpetuates the fear, I believe. And so I don't think that we should be that fearful. I'm not the other side of that spectrum either, in saying that it's no big deal. I take it very seriously, and we've done all the CDC things that we can in our office to make sure that people are safe and feel safe. But for you and I, you in the staging or those in the real estate business, you got to go off of facts. You can't go off of just emotions and fear. Look at the data, know what the precautions should be and how to avoid the biggest risk factors and the spread of it. And you know, the second thing is the things that you can control is what you should operate in. You can't control that another 100 got diagnosed in your state. You can't control that the government's going to do this, that, or the other to help you. You can't control any of those things. What you can control is you can boost your own immune system. You can keep your family protected by instilling good cleanly habits and avoiding exposure. And if
I
your
know we had to
18-year-old is wanting to go
set
ahead.
our youngest down yesterday that
Right.
is 18, and he's ready to just stay out. He thinks he's on extended spring break, and it's like, well, wait a minute, you've got to understand how serious this is, because what he picks up outside is going to come back in to our house and potentially expose us, and then your patients and everybody else, right? The ripple effects. So
That's right.
right, keeping your family, I guess, in the awareness zone of how serious this is,
Yep.
because knowledge is power, but facts.
That's right. Facts first, operate in facts, and then the things you can control, which is keeping yourself immune system good and minimizing exposure.
Yeah,
And
that's
we'll all get through this. As an encouragement, people think the sky is falling, and maybe the market has fallen, and maybe real estate will struggle through this because of some correction in our system or whatever. But just know this: we'll look back on this at some point and say it was bad. We might know of somebody who got positive tested, or we might know of someone who knew someone. I still have yet to meet anyone who even knows someone who's been positive. But if the numbers as of today continue on the same trend, then we're going to all know somebody that did, because it's going to affect a lot of us. But just know this: over 95% of the people that test positive are symptom free and healthy within 2 weeks.
Yeah,
So
that's
I was
right.
listening to the CDC just on Saturday, and a representative from the CDC said, if you get these symptoms that you normally might have gone to the doctor for 3 or 4 months ago, and you think it is the COVID-19 because you fit every category, then take some Tylenol and eat
Treat
some chicken soup
right.
and have the flu for a few days. And if you're not in one of those risk categories, you're probably, more than likely, statistically speaking, 95% are going to be just fine.
Yeah.
And so if you're outside of that realm of the normal population, maybe you're elderly, or like I said, you already have a COPD, or you're a chronic smoker, or you're an
Well,
alcoholic.
you
Those
hit the
things
nail
are
on the
bad.
head. I was about to say, I mean, those of us that are smoking and drinking too much and all that stuff, this is the time. This is what a good reason to stop, because now those little soldiers are again trying to fight that off, and they get tired. And after they fight the same battle over and over and over, they don't have the strength to fight new battles. So clean up your health, clean up any other junk that might be going on that we've allowed into our lives, bad habits, any of that good stuff. And I think that's a really good some good recommendations there. And hopefully we can unmask soon, take the gloves off, but it all depends on how well we get over this curve. And today, the decisions we make now are going to impact tomorrow. So making those great decisions.
That's right.
Good stuff.
I couldn't have said it better myself. Thanks for doing what you're doing. You're going to help a lot of people.
Thank you for your time. And then if anybody wants a one-stop shop for any products, where can they find those?
It's our website, trinityintegratedmedical.com. It's the name of my practice, trinityintegratedmedical.com. And on there's an online store. You can click through and see the products there and place orders, and they come drop ship directly from those manufacturers. And some of them require refrigeration, so they'll come in a box with ice packs, and you got to put them in your fridge.
This is serious stuff. Not anything you're going to
I
find.
have me and our family on this.
Yeah.
I started making our youngest start his doses of the high vitamin C just a few days ago. And we keep enough on stock for our family, and it's what we're choosing to do to fight this and be proactive and not reactive.
And there's like 5 products. It's not a whole lot, but those things, hit your emergency, hit anything else that you guys can, that you might have in your cabinets at home that are going to boost that immune, but then get the real stuff too that's going to go straight into your blood system so that you have better effects. And know that stem cells, right? They may be an answer for some of us. I asked Tim, I'm like, so if we get this, like our family, if we were to get this and it was to turn into something that becomes negative, would we do stem cells? And he said, absolutely. So if he's saying that our family would do it, you guys are family too. They're not the cheapest things, but at least they have shown to be a good solution to this. And hopefully we will have a great, anti-virus, I don't know, something soon that we all pretty much can fight this and it not be a situation. We can look at history, and it doesn't look as, it's kind of gloom and doom there. The good news is we have better ability to deal with this onset and hopefully minimize the after effects and of it all. So I just appreciate you sharing, and then anytime you guys need to reach out to Dr. Tim, you can do Tim Uselton at Gmail. What else? Is that pretty?
The easiest way nowadays is our Facebook group. It's called Trinity Health and Wellness. Trinity Health and Wellness. And that's where we keep in touch with our patients. But anybody else who needs information, daily drips of good, helpful hints and things that I'm sure you're used to sending out and receiving if you're in the real estate business from someone. But these are all health related things. And you can always go there and find us and plug into us there. And, see our live Facebook Live posts and our webinars and stuff that we're doing to help our patients. You can be a part of it.
That's great. Knowledge is power for sure. Get the facts. So thank you so much, Tim. We appreciate you.
All right. Thank you.